Los Angeles is home to millions of people looking for a healthier lifestyle. Well, look no more. Your World Today is here and is a show offering you a wide array of topics to improve your quality of life. From a healthier living to making smarter decisions. Welcome to Your World Today.
Hi, and welcome to Your World Today. I'm Kerrigan Von Poy, and as you can see, we're not in the studio again today. We're at White Memorial Medical Center, and we're in the Imaging Center, where we're going to learn a little bit about imaging, radiology, and things like that. Let's check in with Ophelia, who's talking to our doctor. Hi, Ophelia.
Hi, Carrie.
How are you?
I'm great.
Good.
Well, I'm with Dr. Ed Gabriel. He's medical director for the Department of Radiology. Welcome to the show, Doc.
Thank you so much.
So, we've been talking a lot about our hometowns. He's a local boy from San Bernardino.
Local boy.
Good. We like that here at White Memorial. So you're going to tell us how these amazing machines help save lives, Doctor.
There's a lot going on in here.
There's a lot. You hear that noise? Does that stop?
That never stops. We're really excited about what we've done here. This is a very, very expensive and technical imaging center right in the heart of East Los Angeles. And the technology we have here rivals anything you can find at UCLA, Stanford, USC, or even Harvard.
Really?
These are big places.
Yeah.
And so we
Certainly.
are actually providing this technology to the local community. This is the highest end medicine gets when it comes to diagnostic radiology.
So this is kind of a little gym nestled here in Boyle Heights that people might not know is here.
Absolutely. Not only do we have this great technology, we have some of the best people in the world taking care of our patients. And so we're proud of it. I hope it shows. We're really proud of it.
Doctor, tell us the function of this machine behind us.
Behind us is an MRI. An MRI is a machine that looks inside of us and helps us diagnose disease using a magnet. It doesn't use X-ray, it doesn't use radiation, it doesn't use sound waves, it uses a magnet. And magnetic field's kind of a radiation, but not like we think of it. This is a 3 Tesla MRI, and I know that doesn't mean much, but it's very, very strong, and there's not a whole lot of these around. This is state-of-the-art. This is the best of the best.
Now, you said Tesla. I know Tesla from
Cars.
the cars that you drive around.
Of course.
But
Isn't
when you're
that funny?
talking imaging, what does that mean?
What Tesla is, it's a measurement of how strong a magnetic field is.
Okay.
And so that's where the word Tesla came from. It's a scientist at the turn of the century, like Edison.
Right.
And so that's where the Tesla car came from, and it's our measurement. But this is just a really strong magnet.
So, doctor, tell us what kind of stuff can you find in the human body with this machine here?
Okay, the advantage of this machine is it's allowed us in the last 10 years to look inside the brain, the spinal column, the joints, the chest, the abdomen in ways that we've never been able to do before.
Is it in 3 dimensions?
It's in 3 dimensions, and not only that, it's in color, and that doesn't mean much from an oh wow standpoint. It's in color so that we can look at different disease processes. Very clever thing. It also allows us to look at the heart. And so now we have a way to look at the heart in 3 dimensions and see how it's pumping, how it's functioning, how the blood is flowing, and we don't have to do anything. We don't have to poke a hole in the patient. We don't have to put any catheters in. It's almost like Star Trek.
So we're able to get the complete picture without any kind of damage to the body or any kind of
That's correct.
surgery or anything.
That's correct. Now, the one thing though, the MRI, because it's such a strong magnetic field, we can only go to here.
Okay.
If we go beyond the door, any metal that you have on, the magnetic field will pull on, like your earrings.
Oh, really?
Or your microphone or your pen. So you'll notice that there's zones here. And this
Right.
is for patient safety. We have it all designed so that patients cannot go in an unsafe environment.
And I'm noticing a small sign here that has a few things that aren't allowed in there.
That's right.
So, doctor, if you have a pin inside your body, an orthopedic situation, what happens?
Well, now that's an interesting question. It's a great question because in today's world, in the last decade, all of that stuff that goes in your body is designed to go in there.
Oh, Oh, okay.
Okay, now things that were 30 years old, not so much. But what happens is our technologists are very, very educated in this department. Radiology technologists almost all have bachelor degrees at least. And so they have training in physics, they have training in medicine, and they're incredible. They're like a physician's assistant to us.
Right.
And so no patient will get in there unless all of that's been screened out. We know how old it's been, and we know if the patient's safe.
So are those pictures like watching digital television?
They are like watching digital TV, but they're like watching a really good animated segment,
Okay.
like CG.
Okay.
And so they're three-dimensional, they move, they let us know what's going on inside. They're incredible. They're incredible. It's incredible to be able to see the heartbeat, to see how it beats, to see how the walls work, to be able to see the anatomy.
That's great information, Doctor. So we're going to go to a short break. Don't go anywhere because we're going to take a look at another amazing machine of imagery in this department. So stay tuned. A lifetime of memories begins here at the White Memorial Medical Center. At each and every step of the most miraculous and memorable moment in your life, we'll walk you through everything you need to know to start your own set of memories. Our diverse, walkable, vibrant campus is equipped with the latest medical technology. Call to schedule your free maternity tour.
We're excited to tell you about our website, yourworldtoday.tv.
Take a look. Find out more information about Your World Today's guests, topics, and more. We'll see you there at yourworldtoday.tv.
Hi, and welcome back to Your World Today. We're continuing our visit at the White Memorial Medical Center Imaging Center. And Dr. Gabriel, we're in a different room here. Tell us a little bit about where we are.
This is our PET CT room. So what that means is this is a combination of two pieces of equipment. Everybody's heard reference to CAT scan.
Right.
Okay, so this is a CAT scanner or a CT scanner. It uses X-rays and allows us to get three-dimensional images of the inside of the body. Okay, so this is a 64 slice PET scanner, which makes it even more sophisticated. It means there are 64 slices happening every time it takes a picture. What it does, it takes 64 layers of picture at once.
I see.
This machine, though, is very, very special because it's linked up to what is called a PET scanner, P-E-T, and that stands for positron emission tomography, whatever. What it means is it's a way for us to look for cancer. And it allows us, it's a nuclear medicine study that allows us in 3 dimensions to look for cancer, little very small cancer cells and tumors. And how we do that is we inject a very small dose of what's called a radiopharmaceutical, doesn't matter. It goes in the body and it actually seeks out the cells and shows us where they are, and it shows up on a 3-dimensional picture. That picture is then placed on top of the CAT scan pictures we have. Now we have this incredible 3-dimensional map of the inside of the body. We can see if the cancer cells are there and what they're associated with. That's incredible technology.
Wow, it's mind-boggling actually to try to understand that there's a camera, there's a picture of your tissue,
Yeah.
layers of your
Yeah.
tissue to find the damaged cells.
Correct.
It's amazing.
And that
Yeah.
these two pieces come together to make an even bigger, better picture that can help the doctors see what's in us.
Yeah, 10 years ago, this would have been 2 separate pieces of equipment, as big and twice as expensive.
Of course.
And-
Twice as much real
and,
estate
yeah,
covered.
twice as much real estate, and the patient would have to go in 2 times for 2 separate visits. Now we're doing it simultaneously as one. And so what's that mean as a patient? As a patient, it's so much more comfortable and so much less scary.
Easier.
And they only have to do it once.
Once.
And now we have the ability to take somebody that we know has cancer and follow them and see if the treatment's working and give them peace of mind and let them know that what we're doing is helping.
Is this only used for cancer or other diseases?
No, actually, this piece of equipment, first of all, we're very, very fortunate to have. There's not a whole lot of these around.
Really?
So again, we are giving this incredible medical technology to this community. And in most places, you have to go to the university for this kind of technology, or you have to go to Stanford, or you have to go to UCLA or USC. It's right here. It's right here at White Memorial.
Right here in Boyle Heights,
Right
guys.
here in Boyle
Yeah.
Heights. And so what's incredible about this from a standpoint of money, this hospital's invested years and millions of dollars in this community, but the money's not free. They have to be good stewards with the money so that we can give the community the best care possible. This kind of equipment, because it's integrated, gives us more bang for the buck. So we can do conventional CAT scanning or CT scanning. We can just take pictures of the brain or the chest or the abdomen. We can do conventional PET scanning. We can combine them together. We can do nuclear medicine. We can do many different things with this.
So you're saying, even though this is two separate pieces combined into one, you can use them separately
We can.
if you choose to?
We can. We can use them for so many different applications.
Dr. Ed, something that calls my attention is that, talking again off camera, the years of schooling necessary to learn this stuff. After medical school, how many more years did you have to go to another school or to do this?
Most diagnostic radiologists have an additional 5 years of training and then a year of fellowship, and many of my partners have had 8 years of training. And so after med school, so I was about 29, I did 6 more years.
Wow.
So I kind of started when I was 35. And
To work
to
as...
actually do this. And I'm 56 now, so I've been here since I was
You look very
28.
good, Doctor.
well, thank
So,
you. That's nice.
so this is serious business. I mean, this is top doctors, education, years and years and years of training.
And as Dr. Gabriel was telling us, that he oversees the radiology across this entire campus here at White Memorial, which is quite extensive from what you were telling us.
That's correct. Our group has a group of diagnostic radiologists. Some of my partners have PhD in addition to their MD.
Yeah, so it's
yeah.
not like we're going to
It's
go
an
to
educated bunch.
the radiology department and it's just some guy that went to a local school
Right.
and,
Yeah,
and,
right.
and got a little diploma. No,
Yeah.
this is serious stuff. So we're going to take a break, Doctor. I wish we can stay here and talk about this machine and your training, but we are going to go, when we come back from our break, we're going to go see another room with another fascinating machine.
All right.
All right.
Stay with us.
Do you have questions about your health insurance coverage under Obamacare? Are you confused about Medi-Cal and Medicare dual coverage? Are you worried you won't be able to keep your doctor? Our friendly counselors at White Memorial Medical Center's new Community Information Center understand your concerns and can enroll you in coverage that meets your needs. We are here Monday through Friday to answer all of your questions. We invite you to come and visit our Community Information Center at White Memorial and let us help you.
Welcome back. This is Your World Today, and we're here with Dr. Gabriel at the Women's Imaging Center at White Memorial Medical Center.
Which is part of the imaging center and where we've seen all that fantastic equipment.
Amazing equipment they have here.
Amazing.
State of the art.
Life-saving stuff. And we're still here. And this is Dr. Gabriel, the piece of resistance.
This is our digital mammography unit. And what this is used for is cancer screening for women. This is not nearly as technically advanced as what we saw, but this saves lives. 1 in 8 American women end up with breast cancer somewhere in their lifetime. 1 out of 8, that's a huge number. And we reach out to the community and we screen them for breast cancer. The thing with breast cancer screening in this country is great majority of breast cancer is completely curable if we catch it early.
On time.
And there's only one way to catch it early, it's with this.
This guy.
Yeah, this is a digital unit, which means that it doesn't use film, it uses a computer system, We were the first hospital in our part of the world to have it almost 12 years ago. We were way ahead of the curve. This is a brand new unit. We've been doing digital mammography ever since. And what it amounts to is the dose of radiation is very, very low. It's very little to worry about. It's actually less than a chest x-ray.
Okay.
Okay, that's really important
It's
to
a
me.
great reference.
It is a great reference. And so to even make it more understandable, we have x-ray radiation from the sun we see every day when we go outside.
Right.
Our bodies are kind of used to that form of it. If you fly in an airplane from Los Angeles to New York, that's about the same dose of x-ray as one mammo,
Okay.
roughly.
Okay.
And so that's pretty good
So
reference.
something that's not really harmful to us.
Something that
we've
do
exposed
all
to
the time.
normally.
Yeah, a couple of days outside.
Right, right.
So nevertheless, that's what this does. And women have a lot of questions about it. Tell me what scares women the most about mammography.
One of the reasons why I'm so excited to do this segment is because, see, a lot of women are afraid, and husbands of actually coming and doing this, but this machine, there's nothing scary about it. I just went to my mammogram, and it was a breeze. What you do is you put your breast here, correct?
Correct.
And then you put this on
and
top.
basically what happens is we take 2 views of each breast on this unit. The breast goes on this plate, and then this plate goes on top of it and pushes it down a little bit. Now this is the part that most people are most scared of, and I think this is the part that most women talk themselves out of getting a mammogram for. This pressure from this plate is done so we can reduce the x-ray dose.
Right.
It's performed so we can do a better job. It's not performed because we're trying to be mean or
No, you
do
have
anything
to.
like that.
You have to see all
It
the
wasn't-
tissue spread out.
it was
That's
not
the
designed
point.
by a man to
It's not a torture
Get
device.
back at women.
no, not at all. And so consequently also this can't hurt you. And I think that's a really important part. It's controlled by a computer. If you ever have a mammogram and you're worried about it, have the technologist show you this piece. It stops automatically. It'll never rip your skin. It'll never compress your breast to pain. It'll never do that. 4 views. It's like, it's about as painless as it can be, but it's the only form of cancer screening that we have for breast cancer that works. It's the only one that's been proven over and over again. When a woman starts cancer screening at age 40, we save lives.
And you've come a long way in terms of technology because
by far.
when I started getting my exams, it was some terrible machines that actually caused more pain.
Right.
This is a breeze, and it's fast.
It's fast, it's very fast, and the interpretation is very accurate.
And so this is a device that women are coming in to use this when they think they already have an issue or something, or they're using this from the beginning,
No,
just
this-
periodically.
Both actually. A woman should start breast cancer screening roughly at age 40 under the direction of your physician, and basically every year until which time we either agree to stop because you're too old enough to care or we need to stop for some other reason. And it just takes a couple of minutes. The whole department back here is run by women. There's no men back here except for me. The mammographers, the radiologists that read these on our team all do at least 10,000 mammograms a year. That makes them experts.
Doctor, someone told me a tip so that your breasts don't hurt when you get the exam is don't come when you're going to get your menstrual period.
Yep.
Come after, and so that way your breast won't be as tender and it won't hurt.
Right, and that's a great tip. And so what we recommend for the women that we have come here for the examination is you know your bodies. You know at which time your breast is very sensitive and when it's not, and that may differ from woman to woman. Try to have the examination when your breast is not sensitive.
Right.
And consequently, it becomes a less unpleasant examination that way.
Standing close to it, we can see that this machine looks shiny and brand new. I mean, this must be some of the best technology that's available, too.
It is. This is actually a couple of months old. The one next door is 1 or 2 years old, and we're installing a brand new one across the street.
Doctor, we don't want to go without you telling us what is, again, the most important part of coming and screening with a mammography.
The most important part is when you catch breast cancer very early. It's very treatable. And as a man, I feel an incredible passion for the women in my lives, my daughter, my mother, my wife, my sister, and all men in this community should feel the same. We owe them that opportunity. Even if a little cancer is found, it's treatable. We give them incredible opportunity to have a normal life. This is the way to do it. There's no other way.
And it's easy. Just call in, make an appointment,
That's
and
it.
come in, right?
That's it, and we'll take care of you.
All right.
Absolutely.
Well,
All right.
thank you.
Wow.
Thank you so much for all that information.
Well, thank you. It's a pleasure, and I think this is an important thing for the community to know
A
about.
great resource for the
So
community.
there you have it. No excuses. Come and get your mammogram.
Absolutely. And I guess that's the end of it for
That's
today
it.
for us.
That's it. You want to message us in social media? We're in. You can see the shows on YouTube.
Shows are on YouTube. You can visit our website, yourworldtoday.tv.
Facebook, Twitter, we're all over the place.
Come find us.
All right, well, thank you.
Thank you for joining us.
See you soon.